Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Chronic arsenic poisoning. Chronic arsenic poisoning. There is hyperkeratosis of palms and soles. Raindrop pigmentation is seen. This raindrop pigmentation is brownish mottled parts over the eyelids, forehead, and temple. The rashes of arsenic resembles that of measles or Addison's disease or secondary syphilis. These are the differential diagnosis. There is Aldrich-Mees lines are seen. These are present on all the 10 fingernails. Here in Aldrich-Mees lines, you will see presence of transverse lines on all the fingernails which are 1 to 2 millimeters wide striations occupying the whole breadth of the nail. Painless perforation of nasal septum is seen. Cocaine also causes this painless perforation. Peripheral neuropathy is seen. This peripheral neuropathy is both sensory or motor, and this peripheral neuropathy is also called glove and stocking distribution. Sensitivity of peripheral neuropathy is reduced for pain, touch, and temperature. Blackfoot disease. Blackfoot disease is a peripheral vascular disease and it produces ulceration, gangrene, and spontaneous amputation of the extremities. So it produces ulcer in Blackfoot disease. It is a peripheral vascular disease which produces ulceration and gangrene, and also spontaneous amputation of the extremities is seen. Arsenophagitis. Arsenophages are those people who consume arsenic daily for its aphrodisiac properties.
thank you and thank you for watching.